Concepts of Disease and Illness, a lecture. So a little bit of background, thinking about kind of some of the philosophical assumptions when we bring a biomedical perspective to things like disease and illness. I mean, generally speaking, in biomedicine, there's going to be a distinction between the subjective mind of the patient, their thoughts and feelings, their consciousness, and so on, and their body, right? The kind of objective existence of the substance and mass of their body. And these can be thought about as two really different kinds of domains. How a patient perceives some kind of disorder in biomedicine is often thought of as subjective and distinct from the kind of actual objective bodily disorder in which they perceive. So a subject may say, or a patient may say in a subjective sense, that pain exists in the right or left side of the abdomen. So biomedical doctors believe they have a special method, right? This is grounded in biology and grounded in scientific method to kind of transcend the subjective perceptions of a patient, their own feelings and thoughts and so on, and kind of perceive the body objectively. If we're talking about pain in the right or left side of the abdomen, right, they can get to a physical disorder in one of the body's subsystems, let's say, within an organ like a liver or stomach. And so this idea really kind of informs this concept of disease and concept of illness in anthropology. So we make a conceptual distinction between disease and illness because disease, that category, includes the biomedical understanding of a disorder, just what we kind of talked about there, the structure and function of the human body. And it includes the science of biology and how it understands the body and so on. But if we think critically about some of those assumptions, we have to recognize that disease and biomedical understanding does come out of a particular way of understanding the body, a particular cultural way of understanding the body, and has that degree of subjectivity of any particular perceiver of the body. It's just a dominant medical system, biomedicine, and brings a biological and medical system of thought that has this role of objectivity. It's a powerful system. It is able to have great impact, right, on the world. It has a great capacity to affect change and so on. But it is not just something that exists out in the world. You have to be trained to think and see like a biomedical practitioner in the same sense that any particular person from any cultural background through learning develops a way of understanding the body. So disease is this notion of a biomedical understanding, that specific way of seeing particular kinds of disorder, particular kinds of suffering through that biomedical lens, through the lens that connects to a biological understanding. In contrast, the concept of illness really refers to human beings, patients, the subjective sense of their experience of any one particular disease. It can be the way that they perceive it and the way that they attribute meaning to it. So if we're thinking about a condition like fibromyalgia, well, it can be perceived and experienced in very different ways for different people. People can have very intense pain, very intense fatigue, intense depression, can require hospitalization, and others can have very different kinds of symptoms that are very mild kinds of pain, and they don't have fatigue and don't have depression and so on. And in this sense, we're talking about the illness, not just the biomedical understanding of fibromyalgia, but a individual experience of those diseases, how it affects them, how they perceive it, how it can take on meaning for them. So disease, illness are really important in medical anthropology, and they play a role in relation to culture. So we know, if we start thinking about illness, that disease is perceived and acted upon by different cultural groups in different ways, depending on your worldview. So if we think about the biomedical worldview as one kind of worldview, there are many kinds of worldviews among human populations throughout the world. And so there are different beliefs and values and knowledge about what the human body is, a worldview can present a very different way of understanding suffering, of understanding disorder. Same thing we can think about for social organization, another important component of culture. Biomedical understandings of disease carry with them a particular form of social organization. So universities and hospitals and non-governmental organizations and so on, the relationship between a doctor and a patient, right, in a hospital or a clinical setting. But depending on the population in question, depending on the community in question, the organization, right, between people can be very different, and there can be different norms and rules and expectations of behavior, including treatment and cure, when there is the presence of disease, when there is an illness experience. And the illness concept can be very useful when we are trying to understand maybe what somebody would not extend the term medicine to, or the practice of medicine to. A patient understands illness, the way that they relate with others, potentially traditional healers, let's say. And illness allows us to think through that in a way that disease cannot, right? Disease being tied to that biomedical understanding. Well, once we free ourselves from the biomedical understanding, someone would maybe seeking out certain kinds of healers, right, and certain kinds of treatments that don't fall into the social organization of doctors, hospitals, universities, and so on that we just talked about. And of course, if we're thinking about culture, the kind of base of culture is economics. And so depending on the economics of a particular community, how they're producing their way of life, how they're distributing goods and services, how they're consuming, they may or may not have access, right, to a biomedical system. And that way of life, how they go about living, may inform, right, the way that they interact with each other and that the way that they view the world. If it's not a society that's fully industrialized, is not affected by, let's say, scientific knowledge of biology and so on, there's going to be the presence of very different kinds of understandings. And so illness is a way that we can conceptualize that without the baggage, without the assumptions, right, of biomedicine. So one example we can think about in the notion of disease and illness and why they're useful for an anthropologist is the work by Anne Sigfrid Gronseth in Norway. And in Norway, there are significant social policies, significant humanitarian policies, and Norway accepts many refugees from a lot of different parts of the world. And so during and after the Sri Lankan Civil War, many refugees fled to Norway and for a variety of different illnesses sought assistance from biomedical doctors. But in her research, she showed how the doctors have argued that often in many cases, there isn't disease present, and that many of the reported conditions are psychosomatic. That is, they are psychological rather than referring to some kind of bodily biological disorder. And in turn, Tamil refugees have felt that the medical experience with biomedical practitioners, with doctors, nurses, and so on was very alienating for them. It wasn't very effective in resolving the concerns they had, the illnesses that they had. And they spoke to Anne Gronseth about the way they've appreciated the effectiveness of treatments of various illnesses through their own Tamil cultural medicine that really draws on the Ayurvedic system that you find in South Asia and places like India that will prescribe various kinds of dietary changes to deal with illness, different kinds of herbal medicines, and massage with oil. They found this effective for treating and reducing the illnesses that they had. So in this kind of context, right, it's very useful to tease apart disease as the biomedical understanding of disorders and suffering versus illness, right, which is less ethnocentric, less dependent on a particular biomedical understanding. So in conclusion, we're teasing apart illness and disease. Illness kind of traditionally being that kind of objective understanding of a bodily disorder, and illness being a kind of subjective understanding and perception of it. Thinking critically, We can challenge disease's objectivity and illness's subjectivity. We can see the subjective aspects of a biomedical understanding of disease, and we can see objective foundations for experiences of illness. As we've said, illness and culture are very conceptually interwoven. We could, again, thinking critically, also look at how disease and culture are conceptually interwoven. The kind of way of life, right, that makes a disease orientation understanding possible. Both disease and illness, in that sense, would be informed by various worldviews, social relations, and economics. The kind of point, I think, being, and particularly with the example or case study that I spoke about for Norway and for Tamil refugees, a too narrow idea of biological disease really doesn't always help us as anthropologists understand various kinds of human suffering and human disorder, what that disorder really is and how it may be best treated for them.